These are the real stories of the patients, medical, and support teams of St. Joseph Mercy Health System, whose lives intersect for a brief moment in time to achieve remarkable outcomes.
We bring hope, we bring love, we bring our strength, and all we're made of, you and I, together.
This is the story of life and dreams. Dreams of love, marriage, and having a healthy baby. It's what they aim to deliver every day at St. Joseph Mercy Health System. Only for some couples, it remains just a dream. Unless, just maybe, they find the right doctor and get the right diagnosis. Then, remarkable things can happen. I'm Lila Lazarus, and this is Discover Remarkable at the Heart of Medicine. This time, about the baby doctor, the one who uses a robot. Perhaps you know a couple like Carrie and Jason, ones that fall in love at first sight.
We just locked eyes and we've been together ever since.
A couple like so many who dream of getting married, having babies.
It was not a question, it was just a matter of when.
The marriage happens, but the babies don't. For this couple, Luz and Arturo, it's the same story. They've been married for 5 years. They're desperate to have a baby.
Every month was like waiting for something that didn't come, and month after month was like, is that gonna happen or not? So we started getting kind of frustrated and questioning what was wrong.
You wanted that baby.
Yes. Yes, I want that baby.
And when they meet this man, well, that's when remarkable things happen. Dr. Raj Dina Deu is an OBGYN and robotic surgeon at St. Joseph Mercy Health System, whose life's passion is delivering healthy babies.
One of the biggest reasons why I chose this profession is the opportunity to be in the delivery room. When I was a medical student, that was one of the most unique aspects of your third-year rotation. I mean, you get to be part of this process that's a very intimate, private process, and they are excited that you're there, you know, and I get the privilege of being there, and it still is that way for me on a day-to-day basis. Nicely done. Now just pant here. Just pant. We're gonna suction out the nose and the mouth. The head is out. And pretty soon you're gonna find out whether you're having a boy or a girl, all right? So get ready here.
Hey, mister. What's his name?
Eli.
Eli. There you go.
Thank you.
Hey, buddy.
You do that 3 or 4 times a day?
Yeah, I mean, that's just what we do.
So you are the first hands that will touch a life.
Yeah,
That's pretty
and
incredible.
I'll see those babies after the fact, you know, when they're now 2, 3, 4 years old, and I'll say, you know, when I first saw you, I could hold you just like this.
Yeah. He looks wonderful from head to toe.
The satisfaction that we see from watching a new mom hold that bundle of joy in her arms is just inexplicable. And now, being a father myself, I can just see how important it is on their faces, their smiles, their looks when they're interacting with their child. It's priceless.
But these couples are nowhere near the delivery room, and month after month, it gets more difficult. Luz's gynecologist determined she has 3 large fibroid tumors in her uterus, preventing her from getting pregnant. He sends her to Dr. Dina Deu, one of the first doctors in the state to remove fibroid tumors using a robot.
In Luz's case, her uterus was almost up to her belly button, which is a big uterus. A normal-sized uterus is about the size of an avocado. Hers was probably more the size of a cantaloupe because of all these fibroid changes.
So did you think she was going to be able to have a baby?
I thought there was a good chance that she was going to be able to have a baby, but I was concerned that it wasn't going to happen unless we would do something about those fibroids.
After 1 year, Carrie and Jason are pregnant, but something's not right.
It was very uncomfortable. It was a very uncomfortable pregnancy, just a lot of pain, a lot of pressure. And it was my first pregnancy, so I didn't know if these things were normal. So I think it made it a little bit more scary.
Carrie, too, was referred to Dr. Dina Deu, who discovers Carrie also has a fibroid tumor, hers the size of a grapefruit, crowding their unborn baby, the little boy they named Tucker.
There was a fibroid in there, we call it Tucker's twin. It was so large that Tuck couldn't turn around it, so we had to do a C-section.
At last, Carrie and Jason have their dream, little Tucker. But they knew one wouldn't be enough.
It was very important to me to have a second child right away, but we knew in order to do that, we had to fix the problem of the fibroid first.
But removing that fibroid tumor wouldn't be done the traditional way. Dr. Dina Deu now uses new technology, giving Carrie a better chance to have a second child. What she didn't know is that Dr. Dina Deu would use a robot to clear her uterus. But there's a lot about Dr. Dina Deu that his patients probably don't know. For Dr. Raj Dina Deu, there's a big connection between tickling the ivory and manipulating the intricate instruments of a robot.
There's a big overlap, in my opinion, between the dexterity involved with playing the piano and operating the Da Vinci robot. Your brain has to tell your right hand to do something and your left hand to do something different, but concurrently. And the same is true when we're operating with the robot. My right hand is holding tissue while my left hand is cauterizing, or vice versa.
Carrie will need a myomectomy, meaning her fibroid tumor will need to be removed through an incision in her abdomen. But unlike the days of big incisions and long hospital stays, Carrie's tumor will be removed quickly and easily by a robot under the trained eyes and hands of Dr. Dina Deu. There'll be a small incision and a quick recovery time. And the best part? The robot minimizes the chances of scar tissue, giving Carrie a better chance of having a second baby.
In Carrie's case, she had a 6-month-old at home. I didn't want her to have an open incision that went from the pelvis up to the umbilicus because she's got to go home and carry her child.
And in the old days, had she gone through some of these procedures, it would have been a much longer recovery period, a much more painful procedure.
Much more painful procedure, longer recovery, and the risk of scar tissue formation with an open abdominal myomectomy was one of my concerns, too.
It was very important to me to be able to get out of bed the next day and to keep up with my kids and keep up with my job and everything else that I have to do. I didn't want to be held down. I didn't want to, have to recover.
Dr. Dina Deu is very sensitive to Carrie's concerns. He, too, is juggling his work and family life. His wife, Geetika Gupta, is also a doctor, an emergency physician at St. Joe's. They have 2 very energetic boys, Sahil and Nikhil.
Well, we understand each other's schedules, and we understand that there's some unpredictability that comes up with doing what we do. And balancing that with getting the kids to their activities, it can get a little tricky. So there are times when the 2 of us are going in opposite directions, but again, our priority is to do what we can for them.
Hi, how are you?
Good.
I'm Dr. Gupta. Nice to meet you. How can I help you today?
I know what it's like to wake up at 2 in the morning and 3 in the morning and 4 in the morning and then have to go to work that next day. And the first time that I was at home with the kids by myself, I thought, I don't know how people do this. I mean, it's easier to be on call than it is to be at home with the newborn. I always joke around with patients that if men were responsible for childbearing, we'd have no kids on this planet.
We have 2 different personalities. He's more of the thinker, the one who contemplates, looks at everything from a whole, and I am the one who kind of makes it work and makes it go. And I think we've chosen our careers in that respect also.
The boys love basketball.
Is that a 3-pointer?
No, this is a 3-pointer.
Oh, you can make that?
No, I can't.
Okay.
I'll try.
Oh, man, that was close.
Monopoly.
Well, well, well. $2 in rent, please.
No, Daddy, it's double.
Why is it double?
Because you have both of the properties.
Oh.
See?
They're turtles. On your mark. Get set. Go. No, this way.
This way.
Go.
Yeah.
All right, you win. And they share their father's passion for music.
So it just adds a little bit more character to the piece.
When we get discouraged, our dad comes and sits down with us and like he helps us through it, and then once we start from the beginning, we don't know that we finished it because he just helps us, and then like it seems easy for the next time we play it. Sometimes he just hears his music for the first time he's ever heard it, and then he plays it on the piano.
He knows how to play the piano amazingly, the violin. He used to serenade me when we were young and dating. Wherever we would go, he would always want to play the piano. We went to a bar, or if we went to someone's home, he would just start playing. So for his 40th birthday, I bought him a piano, and he plays that just on his own. I'll come home one day from a shift, and he's playing the piano.
There's this one song that he just can't get. He says it's like the hardest song ever. It's called Claire de Lune. He's got that. No, he said he hasn't yet, but he can play it. He can play parts of it. Not parts, he can play it. No, he can't. Yeah, he can. Okay, whatever. I think my dad's an excellent person.
And Carrie and Jason, well, they think he's an excellent doctor. With the tumor gone, Dr. Dina Deu delivers little Jack. Carrie and Jason are thrilled, but within a short time, Carrie's suffering once again.
I just had a lot of pain, just constant pain, discomfort, tired, exhausted. I felt old. I thought these were problems my mother has. These are not problems that I have. I felt old and I didn't want to feel that way anymore. I ended up in the hospital. I was literally driving home from work and I can't even get myself home. I felt so bad. I knew I needed a doctor. My pain was so bad. It was horrible, and I was actually in the hospital for 4 days.
She came back a few months later and said the periods are no better, the pain is worse, I'm having a lot of right-sided pain. I think I'm ready to move forward with something that's more definitive, and that's where we re-engaged with the discussion of the Da Vinci for hysterectomy purposes. Carrie, this is Dr. Gove.
Hi.
This is Jason. Hi. Dr. Gove. We operate as a team when we're in there. That's our approach to things. So when it's Dr. Gove's patient, I'm at the bedside while he's operating, and then when it's my patient, it's vice versa. So he'll be at the bedside handling all the bedside instruments while I'm doing the surgery.
So how old are your boys? 4 and 2?
Yep, 2 and a half and 4. I'm gonna let the... There you go. I'll go back to
St. Joseph Mercy Health System, Dr. Dina Deu is about to go into surgery and change Carrie's life. He'll tell you he's not doing it alone.
This, in my mind, is a great example of why our team approach is so valuable. We have the same OR crew, the same nurses, the same circulators, the same techs, the same supply people. And from my perspective, operating with a colleague who knows the anatomy, who can anticipate what I'm doing, I think it maximizes patient outcomes. It gives us a great feeling in the OR. We know that we're doing things the way that they should be, and it's just one that improves our experience for everybody involved. Are you scrubbing back in, Juanita? Yeah. All right. Yeah, don't worry. Well, we've got our Da Vinci regulars here, so that's always comforting, so that's good. It's a tough concept to grasp when patients hear that there's going to be a robot operating on them. They envision a self-propelled machine that's acting on its own, and we kind of have to bring them back and say, well, no, it doesn't do anything without me controlling it. Once they hear that there's going to be another surgeon at their bedside taking care of their bedside needs, and I'm actually doing the surgery, 10 feet away from them, I think they get a better concept of what's involved. The hands don't do anything without my hands actually acting, but the hands do mirror what I do. So the tips of those instruments are like an extension of my own hand. So it's actually a great thing to have, and I can see exactly what I'm doing with the 2 lenses that feed into the camera. It's true depth perception, so it's fantastic. The Da Vinci camera here is allowing us to get a visualization of the actual pulsation of the uterine.
What kind of a difference has the Da Vinci robot made in obstetrics and gynecology?
For me as a gynecologic surgeon, my ability to tackle complex cases with the comfort knowing that I can use the robot instrument just like I would with my hand inside the abdomen is huge. From the patient perspective, being able to get out of the hospital within 1 day, get back to their family, see their friends, get back to work within a few weeks, there's no way you can quantify that. With the Da Vinci, we've got a patient who's in the hospital for 1 night, back home the next day, back to work within a few weeks. With the traditional hysterectomy, we were talking about a 3-night stay in the hospital, off work for 6, sometimes 8 weeks at a time. Really just a world of difference in recovery. I'm very happy with that.
I asked her, I said, Dr. D, where will you be? Because you have this picture in your head that he is right there touching you. And he's not. He's in the corner of the room. He's 4 or 5 feet away from you.
All right, thanks everybody. That went well. We're fast.
Just days after surgery, Carrie's home with Jason and the boys.
It was a breeze, honestly. I just bounced right back. I bounced right back. I jumped right back into my life. And, you know, like Dr. D said, he said after you have the surgery, that's when you're going to realize how much you had been tolerating. And I did. I felt great. I felt young again. I mean, I did. I felt like I could just jump up and go. It was a wonderful feeling. I felt like I had a weight lifted off my shoulders. I didn't feel exhausted anymore. Dr. D always has a plan. He doesn't rush into anything. He makes you feel like he really understands what you're going through, and that's very comforting as a patient.
I think we have gynecologists that are so patient-centered. We do the right thing, and I know there are a lot of places that do that, but I really feel just from interacting with the people in our department, patient care comes first, and I think that's a hospital-wide sentiment. I just see that in our colleagues in our other specialties. You can't go wrong. When you've got the patient as your primary focus and her outcome as your primary focus, your emphasis is right.
I feel great. I do. Like I said, my mood is better. I'm not distracted by pain anymore, so I'm able to focus on my kids. I'm able to focus on my job. I'm able to give things 100% again, and that feels really good.
Back to Luz and Arturo. They're still holding on to their dream of having a baby. But for Luz, robotic surgery to remove the tumors is risky.
I even went so far as to say, look, there's a chance that you could have so many fibroids and so much bleeding that you could actually lose your uterus at the time of the surgery, because that's a possibility.
It's a risk Luz and Arturo are willing to take. Using the robot, Dr. Dina Deu removes the tumors and recommends they wait a year to try and conceive. So 1 year after surgery, Luz stands in the bathroom with a home pregnancy test.
And I thought he was asleep, and no, he was awake, waiting for the answer.
What'd you think, Dad?
I don't know, something inside of me was telling me, yeah, it's gonna be positive. There's always the, I don't know, I was afraid that she will say no, didn't happen, so. But yeah, that's what we expect.
No, aquí están.
9 months later, little Fatima comes into their lives.
It was a joy for me because to be able to see that process from start, how we were going to handle the surgery, would it work, were we going to be able to do it with preserving her uterus, to now being on the other side where she's holding a baby in her arms. I mean, that was a hugely uplifting moment for me. I only have boys. I have little nieces, but only have boys of my own.
And chiquita? I'm blessed with her.
I see something that was missing in our lives, and now we can consider a family.
When you see Luz's face now, and when you see that little baby's face, what do you think?
That's just joy, because she's gotten to where she wanted to be, and I like to think that I helped play a little role in that whole process. But just even listening to her talk, I mean, she's just happy, and that's our goal. I got to tell you, I was very, very happy when I heard that you had a baby. So, and just happy for you and your husband and your family. So,
thank you.
Congratulations.
Thank you so much. I'm happy. I'm very happy.
The right doctor, the right robot, the best outcomes, remarkable breakthroughs. They happen every day here at St. Joe. Hi, hi, don't cry. And that incredible Da Vinci robot, it's being used to battle everything from snoring to heart disease, even cancer. That's Discover Remarkable. Congratulations. I'm Lila Lazarus. We'll see you next time.